Good day and a very welcome to our series of slides on the assessment of the fetal status using the cardiotachograph. I'm Anna Nolte and I'm going to teach you through these different lessons. In this lesson, lesson 1, we're going to do the introduction and the welcome to the course, and I'm going to explain the course to you. Why the whole course on CTGs and on interpreting CTGs? Now, gradually over the past years, we had a transition from the low technology auscultation, like you can see here in the photo with an ordinary fetoscope, to the high technology of electronic fetal monitoring. And every midwife who works in an antenatal ward and who works in the labor ward will use the CTG from time to time. And that is why it is so absolutely important that all midwives should be able to know and interpret the CTG. Now, whether we use the CTG or not depends to a large extent on pregnancy risk factors, whether there are or not, the current clinical situation in the hospital or in the clinic where you work, what is available and what is not available. And then very obviously, very important is the patient's preference. Yes, the patient has a choice whether she wants her baby's heart to be listened with the CTG or not. And we will come to that again and discuss it again. Well, the nurse to or the midwife to patient ratio also plays an enormous role. To a certain extent, the CTG helps us to do observations of the fetal heart rate when it's really very busy. And then also depends to a very large extent on the institutional policy on when CTGs are supposed to be done and when not. Now, both auscultation as well as CTGs are being used for the evaluation of fetal oxygenation and to see whether the fetus is in a good condition during pregnancy as well as during labor. And then secondly, it's also depending on what we found in the evaluation of the fetal oxygenation, we need to decide whether we need to implement some corrective measures if there is a lack of oxygen, for example. Now, there's a lot of debate and a lot of discussion and evidence in both directions about CTG and its association with neonatal seizures, whether it prevents them, whether it be by preventing or evaluating the fetal oxygenation, one can prevent them by diagnosing the hypoxia early enough, and the same with long-term neurodevelopmental outcomes and cerebral palsy and infant mortality and so forth. Now, the use of continuous CTG was associated, and there's a lot of evidence for that, with higher rates of medical interventions, specifically cesarean sections and also instrumental vaginal births. So therefore, it's very important to use the cardiotachography very wisely to really decide whether it's necessary or whether it's not necessary. Now, the general principle is to use it in high-risk women where there's really a need and an indication for it to be used, and not to offer it for women, low-risk women, but to rather use intermittent auscultation of the fetal heart rate instead with either Doptone or with the fetoscope, as we've seen on the previous photo. And there's lots of evidence that also has shown that hypoxia can be diagnosed as well with a fetoscope as with the CTG. Now, just a little brief introduction on what we are going to do in the different lessons in the course. In lesson 1, we've seen now that it was the introduction, and I'm going to tell you about the different lessons in the course. And then in lesson 2, it's not really a specific lesson, but it's a quiz, and it is to determine your skills regarding the CTG. This you don't need to pass, but it will just give you a self-evaluation on how much do you know and how little do you know, and then hopefully motivate you more or less to do this course. Now in lesson 3 then, we're going to discuss the principle of electronic fetal monitoring, the cardiotachograph as such. I'm going to explain the graph to you, how to prepare the woman, the patient, for doing an EFM. Then a little bit about intermittent auscultation and all the aspects regarding intermittent auscultation, and then continuous electronic fetal monitoring. When are we doing continuous electronic fetal monitoring, or when do we do it intermittently? Now, before I carry on about all the different lessons, the course has been developed to such an extent that both beginners who know very little or almost nothing about the CTG can gain from it, but I also think it's a very good revision for people who work with the CTG for quite a long time already and who are doing quite a lot of interpretations and who are quite experienced in this. I think it's just a good way of redeveloping your knowledge and scratching up your knowledge a little bit. And then in lesson 4, we will discuss the physiology of the fetal heart rate control. Now you will see all the lessons have a part 1 and a part 2, and the reason for that is just to keep the videos as short as possible so that we can stop with it, or that you can stop with it before you're really getting bored with my voice. And then at the end of the second part in all the lessons, you will find a quiz that you have to do, and you will have to pass the quiz before you can carry on to the next lesson. So in lesson 3, the previous lesson just now, at the end of part 2, you will do the quiz. You have to pass the quiz before you can go on to lesson 4, and etc. If you don't pass the quiz, then obviously you have to go back to lesson 3, repeat lesson 3, and make sure that you know that you have the knowledge and the skills that's been tested in the quiz in lesson 3 before you go on to lesson 4. Now in lesson 4, we're going to focus on the physiology of the fetal heart control, and that to me is such an important aspect of CTGs. And I'm always saying that makes the physiology of any aspect so very important, because if you understand what you are working with, it's so much better to know how to assess the patient, to know how to correct the condition if there are any problems, etc. So, as I'm saying, a very, very important part of CTGs. So in the first part, we will do the normal uteroplacental exchange, how the exchange work in the placenta during pregnancy and specifically during labor. That's very important. And we're going to do the autonomic and the somatic components of the central nervous system and how that controls the fetal heart as well. Then in part 2, we will discuss the baroreceptors, the chemoreceptors, the fetal adrenal glands, etc., and their influence on the fetal heart. And then you get to your quiz, and you have to pass it before you can carry on to lesson 5. And then in lesson 5, we start with the interpretation of the CTG. And here we are going to do in part 1. The whole of lesson 5 is basically only on normal cardiotachograph. So in part 1, we will do the normal baseline and the normal baseline variability. And then in part 2, we will do the periodic changes, accelerations, decelerations. And we will talk a little bit about the contractions. And then I just briefly want to talk about the antepartum CTG and the requirements, the conditions, the normal characteristics, etc. of the antepartum CTG. And then in lesson 6, we will do the abnormal or the complicated CTGs. We will in part 1 discuss the abnormalities of the baseline, the abnormalities of the baseline variability, and then in part 2 we will do accelerations and all the different kind of decelerations, as well as the contractions, abnormal contractions, contractions that has an influence on the fetal heart. And then in lesson 7, our final lesson, there's only one part, and there we discuss tachystoly, too many contractions. In the case of contractions, we will talk about CTG guidelines that we use for interpretation. We'll discuss the FIGO guidelines and the NICE guidelines very shortly. Then we will discuss what is hypoxia really, how do we see hypoxia on the CTG, and how do we manage it according to the FIGO guidelines. And also in general, we will talk about in utero resuscitation. What do we do when there are abnormal CTG patterns? And then you get to your final quiz, which you have to pass in order to get a certificate from us to say that you have completed that course and that you do have knowledge on CTGs. And that brings us to the end of lesson 1. You're going now to complete the quiz in lesson 2 before you can carry on to lesson 3. And I hope you will be pleasantly surprised with your knowledge on CTGs after you've done the quiz in lesson 2. Okay, see you in lesson 3.